The next item of business is an urgent question from Neil Bibby. Neil Bibby, please.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to reports that the Health Secretary authorised the purchase of 50 beds to move untested patients into 10 care homes in Inverclyde, which has the highest COVID-19 death rate in Scotland. How many of these homes have experienced a subsequent outbreak of the virus, and how many deaths have there been?
Jean Freeman.
As part of our planning for COVID-19, we asked all health boards and jointly with COSLA, all health and social care partnerships, for their mobilisation plans in order to make sure that we were ready for worst case scenarios that were being proposed from SAGE and associated modelling. Our plan was to create a bed capacity in the health service of 3,000 beds and to double the number of ICU beds at that time. Inverclyde regularly has the lowest level of delayed discharges anywhere in the country, but the Health and Social Care Partnership anticipated more people coming through the system more quickly with high levels of care and support needs. So as part of their advanced planning, Inverclyde secured an additional 50 care home places be called upon if required. 40 places have been used to date, covering 8 care homes. There are 14 care homes in Inverclyde. The total number of deaths in those 14 is 35. As part of the Scottish Government's commitment to testing, all the homes will have been fully tested by this coming Monday, the 25th of May. And to date, my understanding is that 3 staff have tested positive. On the number of those 8 homes which have experienced one or more than one COVID-19 case, my apologies to the member. In the time available, I have not been able to get robust data on that, but I do commit to writing to him very shortly as soon as I have that, so that he has that additional answer to his question.
Neil Bibby.
I thank the Health Secretary for that answer. I believe it's vitally important that the full facts about outcomes of Scottish Government decisions are in the public domain, and I look forward to receiving that further information from the Health Secretary. I think this is particularly important given there's been some confusion about figures in answers that ministers have given in recent days. It has at times appeared that ministers have tried to avoid giving figures, or that they have been unclear what the accurate figures are. No one questions that ministers believe they have acted with the best of intentions, but may I ask, does the Health Secretary regret authorising the purchase of beds for hospital patients in unprepared care homes herself without testing? And does she believe that this and the known problems with PPE were likely contributory factors towards the failures to protect care home residents in Inverclyde and West Scotland?
Jean Freeman.
So I want to make a number of points in response to that, and I'm grateful to Mr. Bibby for his supplementary question and for the way in which he has asked that. These were decisions that I made, but they were made on the basis of the plans that local health and social care partnerships had come forward with, because they know their own areas best. They anticipated across all those health and social care partnerships what they believed would be the demand coming in their direction at that time, and what they thought they needed to do in order to best meet that demand. I'm not trying to absolve myself of accountability. I signed off on those final plans, absolutely, but they came from those partnerships, and of course those partnerships involve both health and local government. In terms of whether or not those patients should have gone into care homes or indeed to their own home in the absence of testing, I think I've said before that if there are many decisions, I am sure, that as we look back, if we had known at the time what we know now about the nature of the virus, the way in which it transmits itself and so on, we would, with what we know now, perhaps have made different decisions at the time. At that point, as I'm sure the member recalls, not least from the Four Nation plan that was published, we were facing what we anticipated to be a significant surge in demand on our health service, And in order to ensure that we minimise the number of deaths there, we took a number of decisions to create capacity for that health service. That, as it has turned out, largely on the basis of how the public have responded to the restrictions that we have asked them to abide by, we have fortunately not reached a position where that full capacity has ever been used. But the other point I would make is that in our care homes, testing is not the only precautionary measure in terms of controlling both the introduction but then the spread of the virus. All our care homes should have proper infection prevention and control for previous infectious diseases, winter vomiting, flu. The member will know these as well as I do. So infection prevention and control and adequate PPE, including knowing how to use that and the proper training given to support staff, is critical. And as he will recall, when the private care and public care homes' own PPE supply chains became disrupted, government stepped in order to ensure that we could make sure that PPE was supplied to care homes in Inverclyde as elsewhere.
Neil Bibby.
The Health Secretary for that further answer. As I said before, I believe it's vitally important that we have the full facts about the outcomes of Scottish Government decisions. Almost 1,000 patients across Scotland now appear to have been discharged from hospitals to unprepared care homes without testing that we know about. Has the Cabinet Secretary seen, asked for, and will she publish any report which details the specific homes across Scotland that received such patients that went on to experience a COVID outbreak, and the number of residents and staff who became ill, tested positive, or died in each case? And can I also ask whether new care home units are established for this purpose?
Jean Freeman.
So I share with Mr Bibby the desire that there is as much transparency as possible and that accurate information is given to members. And as I hope he knows, I have this morning written to his party leader as well as others to clarify some of the concerns that have been raised around this matter in the recent days. In terms of the information that he asks if I will publish, my commitment will be to go away and look at that in detail, to publish as much of the robust data as I believe we can, and to advise the member and other members of my response to that particular part of his question. And the only caveat I would make on that is the idea of naming specific care homes. I would have a little anxiety, but I need to take advice on this as to whether or not the naming of particular care homes where perhaps there has been only one admission from hospital to that care home is in any way a risk around identifying who that individual was. But as I say, I will take advice on that, and in as much as I can publish the response to the members' questions, I will do that, but I will certainly write to him and let him know whether I believe I can answer and publish all of that information, or whether there are areas where I don't think I can, with an explanation in those areas of why I don't believe I can produce that information.
I would like to be able to take all of those who've asked for a question, so if I could ask for, please, more succinct questions and answers, we may well be able to do that. Stuart McMillan, please, to be followed by Miles Briggs.
Thank you, Presiding Officer. The Cabinet Secretary just highlighted the importance of effective prevention and control measures in care homes and hospitals to ensure the clampdown of COVID-19 to help protect lives. I'd be grateful if the Cabinet Secretary can set out what steps the Scottish Government has taken to support these integral activities in 14 care homes in Inverclyde and also across Scotland.
Jean Freeman.
So as the member, and I hope colleagues also know, we issued guidance to care homes, first of all on the 13th of March and then subsequently updated. And part of that includes, as we have always said, that the critical steps that need to be taken absolutely include quality infection prevention and control measures alongside the appropriate use of PPE for any particular setting. That also, on the 13th of March, asked care homes to reduce significantly the amount of communal activity, including communal dining, and to reduce visiting as well, with one or two exceptions around palliative care and support where needed for residents with dementia. Since then, as I hope the member knows, we have charged our directors of public health and now working with our board directors of nursing and medical directors to directly engage with every care home in their area, to work with the care home to assess the levels and extent and effectiveness of infection prevention control and provide additional support if that is required, to ensure that staffing levels are as they need to be, and if not, to ensure that we can provide additional NHS staff into those areas if employers have not taken from our returners portal, as well as making sure that there is direct clinical engagement from local primary care practices and GPs. And as the member knows, the Care Inspectorate has taken a decision to provide direct inspections into care homes, working on the basis of their own RAG status in terms of previous inspection reports.
Miles Briggs, to be followed by Neil Finlay.
The presiding officer, it has taken 10 weeks for the Cabinet Secretary to provide the most basic information on when almost 1,000 hospital patients have been discharged and where and to what setting. And on Tuesday, that information she provided me was inaccurate. The Scottish Government still has not revealed where, over the whole of April, how many patients have been discharged in April to care homes from a hospital setting. Families want answers, Cabinet Secretary. This is a matter of competence, honesty and transparency, and the Cabinet Secretary has failed on all three. Given all that we now know, does the Cabinet Secretary not realise she has lost the confidence of the public?
Before we go any further, can I say to the Chamber that I expect courtesy at all times, and there's certain language that I think we all recognise as being very discourteous, and I think perhaps all members should reflect on that. If the Chamber would just please be quiet. I think I've made the position very clear and I'll be listening carefully from now on, and I would ask everyone to reflect on how they are dealing with certain issues and perhaps do what most people would believe to be the right thing. Jean Freeman.
Thank you, Presiding Officer. In terms of the situation on what was said by me on Tuesday and subsequently, as Mr Briggs knows, I have written to his party leader, Mr Carlow. I believe a copy of that letter has gone to Mr Briggs himself, setting out the position factually that is factually correct and apologising for any mistake that I made in terms of the language that I used in the Chamber. I've also written to the presiding officer with that apology and asking for the record to be corrected. The April figures will be published once they have gone through the proper process of assuring that they are accurate across all of the partnership areas from all of our hospital settings. And as soon as they are published, the member will be able to see them. In terms of whether or not the public have confidence in the job that I am doing, that is, in my view, for the public to decide. I am focused on doing what I believe to be the right thing, making the right decisions based on the information I have at the time when I have to make those decisions. Does not mean, and I would never claim, that there are decisions that may have been made that if I had the information then that I have now might have been different decisions, but I don't think there can be any doubt about the focus that I am giving to the job that I have to do and my intent, as far as it is possible for me to do this, to get it as right at the time as I can.
You may wish to take the opportunity to accept the apology, Mr Briggs.
And in terms of this whole debate, members across this chamber are doing our
Mr Briggs,
utmost
I
to get that
asked you
information.
if you wish to take the opportunity to accept the apology. If
Yes.
you do not wish to take
Yes, I
that
do,
opportunity, please sit down.
Presiding Officer.
Thank you very much, Mr Briggs. I now call Mr Finlay to be followed by Alex Cole-Hamilton.
Thanks, Presiding Officer. The Cabinet Secretary is more than aware that bed blocking occurs because there is no care home place for people to go to or no care package available for them to get once they, if they are in hospital. In the last year, we've had record delayed discharge because of this. But in March, 1,000 people untested were discharged from hospital to care home places or home care. Now, I'm trying to understand and get my head around how we were able to find those additional 1,000 places. Was that capacity always there? Or was that extra capacity suddenly built overnight or jobs created overnight with additional funding? Because if the capacity was always there, then is it the case that people were kept in hospital not because there was no care home place available or home care available, but simply because local government and IJBs have been underfunded?
Jean Freeman.
So I think there were two primary reasons for the improvement in reducing the number of delayed discharges. And they in part are, at least one of those reasons is a reason we see reflected in our health service, where we have also secured improvements, for example, in the use of digital technology in a faster period of time than we had been able to manage up to the point when we were charged with dealing with this pandemic. And one of those improvements is that we have always had a situation in some of our partnership areas where there has been a minimal to zero level of delayed discharges. In fact, Inverclyde was one of those. And those partnership areas had adopted particular aspects of practice that involved planning for the discharge at the point when the individual was admitted and ensuring that the care packages that were needed, if they were needed, were available to the individual at the point when they were clinically fit to leave the hospital setting. Securing that spread of practice was achieved much more quickly by all the partnership areas and by an absolute focus that that was what we needed them to do, because as I know the member is well aware, having people stay longer in the hospital setting than their treatment requires does risk causing harm to those individuals. And we have all shared across the chamber a desire to see a reduction in the numbers of delayed discharges over for some time up till now. So partly it was about a focus of effort and the spreading and use and uptake of good practice. There was additional funding made available to partnerships in order to ensure that existing social care packages were not depleted. And the member will have heard me speak about my concern in some areas where that has happened, and I don't believe there has been a good reason for that, but also to meet the additional demand that would come for support at home for short periods or for long. In some cases, the creation of intermediate step-down beds, sometimes in a care home, sometimes elsewhere in a more community setting, as well as places in care homes themselves. So I think there were a number of reasons that that position was achieved. And again, of course, as we look back over the journey in terms of dealing with this pandemic and look at what improvements and lessons we would want to learn, some of those will be improvements that we want to see continue into the future.
And the last question is from Alex Cole-Hamilton.
Very much, Deputy Presiding Officer. Minutes of the COVID-19 advisory group held on 2nd of April record a number of priorities, but two stand out. One, to understand the problem of virus transmission in hospitals, and the second, to support the mobilisation of patients from those same hospitals into social care. So it seems that they couldn't understand how the virus was spreading in hospitals, yet they would still send over 1,000 patients into care homes without a COVID test. Given we know those homes were raising concerns about PPE and access to testing at the time, what risk assessment was made prior to that mass movement of patients, and if it exists, will she now publish it?
Jean Freeman.
So, of course, by the 2nd of April, we had already set up the additional support to provide PPE to social care and in particular to the care home sector. And that was being actively used by that date in order to ensure that there was appropriate PPE and appropriate level of PPE in care homes as elsewhere. In terms of risk assessment, individual risk assessments are undertaken. I think the guidance is clear about this in terms of an elderly patient who is in hospital, be it for COVID-19 or not, on their discharge, about what is the appropriate support that they need and the appropriate place for their discharge to be to. So those individual risk assessments are part of what is undertaken. It's not possible to provide and publish individual risk assessments, but that has always been the case in terms of discharging patients from hospital where they will require additional support, be it for a short or a longer period.
Thank you, and apologies to Angela Constance, Jamie Halcrow-Johnson and George Adam for being unable to take their questions. Thank you very much, everyone. There are no decisions to be taken at decision time today, so this meeting is closed.